Today, Clinical Group 205 is going to be covering atherosclerosis with you. Atherosclerosis is the progressive cholesterol plaque buildup on the walls of the arteries of the body. In this video, myself, Stefan, posing as a patient, and my colleagues Megan, Katie, Samya, Abby, Chloe, Maddie, and Andy, all acting as nurses, will be walking through some of the experiences and emotions that a client with atherosclerosis may encounter or experience during their plan of care. We will do this with our teaching plan that has been paired with our teaching tool, both covering the topics of traditional medication and alternative medication interventions, as well as more invasive techniques such as surgery or drug therapy treatments. We'll also cover the short and long-term effects of atherosclerosis and the cultural relevance that it has in relation to affected groups or populations within our communities. As you can see here, this is our teaching tool. It's a pamphlet-style document that allows us to hit all of these topics while also not overloading the client with too much information. And this is our client teaching plan. This is a much more informative document than the pamphlet, with which a client would receive with a diagnosis of atherosclerosis. It covers the same topics as the pamphlet, but allows the client much more information about the medical choices that they have and the lifestyle adjustments that they can make to manage their symptoms while living with this disease process. Now, using our teaching plan and our teaching tool, we're going to be meeting with Mr. Smith individually and teaching him about his diagnosis. This allows him to make more educated decisions about his lifestyle and medical choices, as well as understanding his diagnosis and furthering his own knowledge. The first nurse to meet with Mr. Smith is Megan, who's going to discuss with him his new diagnosis of atherosclerosis.
Hi, Mr. Smith. I'm Megan. I'll be your nurse today, and I'm just going to be explaining your diagnosis to you.
Okay.
Do you want me to close the curtain?
That's okay.
All right. This is a brochure to help follow along with the diagnosis. So as you know, you've been diagnosed with atherosclerosis, and I'm just going to give you a little more information on the disease and what it may look like.
Okay.
And let me know if you have any questions along the way.
Of course.
So atherosclerosis is a disease of the arteries in which plaque builds up along the artery walls.
Okay.
And plaque is made up of fatty substances, cholesterol, waste products, calcium, and fibrin. And as these plaques build up and deposit on the walls of the artery, it's causing hardening and thickening of these arteries. And this can potentially cause obstruction of blood flow. Does that make sense?
Yes. Is there anything I should be looking for?
So it may cause chest pain, cramping, shortness of breath, fatigue, or pain where there may be a blocked artery, which is usually in the arms or legs. And the most common arteries affected are in the heart, the legs, and the arms, or the brain.
Okay. I'll be looking for those symptoms.
Do you have any more questions about your diagnosis?
No, I do not.
All right. Let me know if you need anything. I'll be back to check on you in a little bit.
Thank you very much. Now that Mr. Smith has met with Megan and discussed his diagnosis of atherosclerosis, he's going to meet with Katie, who's going to discuss his risk factors and things he should be concerned about with his new diagnosis.
Hi, Mr. Smith. Thanks for coming in today. I hear you have questions about the risk factors of atherosclerosis. So, one of the major ones is a diet heavy in saturated and trans fats. These can increase your LDL levels, which is your bad cholesterol. It can clog your major arteries, leading to your heart and your brain. It can lead to a heart attack or stroke. Another big one is diabetes. Diabetes drives inflammation, which can really damage your blood vessels. A third one is smoking. There's lots of harmful chemicals in smoke that can also damage your blood vessels, leading to narrowing or clogging. Another one is a sedentary lifestyle, meaning if you're not exercising as much, you're just giving room for these arteries to clog with those bad cholesterols. And the last one is high blood pressure. When your blood pressure is constantly high, putting pressure on your arteries, they can really damage them and, like I said, lead to a narrowing or an occlusion of the artery. Do you have any questions?
I don't. Thank you very much. Now that Mr. Smith is done talking to Katie about his risk factors and the kinds of things that he should avoid in his day-to-day, he's going to talk to Samya, which is going to talk more about prevention and how those things relate to his day-to-day life and the changes that he could make to better his condition.
Hi, Mr. Smith. I'm Samya, your other nurse. Can I get your name and date of birth?
My name is Stefan Smith, February 19th, 1996.
All right. I believe Megan spoke to you earlier about the diagnosis. There are some things that can be done to prevent the worsening of your condition, if you would be interested in learning about it.
Of course, I'll be willing.
So, smoking is something that further damages your arteries and can cause more plaque buildup. So stopping that would be a good step if you're sort of. Another thing is diet and exercise. It's important for you to maintain a healthy weight by eating healthier foods and exercising an adequate amount. Foods that are nutrient rich, such as green vegetables, fish, berries, olive oil, those would be good things to incorporate into your diet. Atherosclerosis is irreversible, but making some changes to your lifestyle will greatly improve the quality of your life. Do you have any other questions?
I don't. Thank you very much.
Okay, someone else will be in here for your
Great.
medications.
After talking to Samia about prevention, Mr. Smith understands some of the lifestyle changes that he needs to make to prevent the progression of his atherosclerosis. He will now meet with Abby and discuss one of the new medications that he will take as a part of his new diagnosis and get an understanding of the potential side effects that it could have.
Hi, I'm Abby and I'm going to be your nurse today. I have your 5 o'clock meds to give you. Can you tell me your name and date of birth?
It's Stephen Smith, February 19th, 1996.
Thank you. Today I'll be giving you a new medication. It's called atorvastatin and it will help to lower your cholesterol levels.
Okay, why do I need that?
The doctors are worried you have some buildup of plaque on your arteries that could eventually lead to stroke or heart attack. This medication will lower your cholesterol levels to prevent more plaque buildup.
Are there any side effects I should be worried about when taking that?
The most common side effects are fatigue and muscle pain. You also take this medication at night because that's when cholesterol synthesis is the highest. Is there anything else I can get you?
No, thank you.
Okay, here's your medication and water.
Okay.
After talking to Abby about his new medications, Mr. Smith is going to meet Chloe. They are going to discuss some of the non-pharmaceutical methods of managing his atherosclerosis. This is a good point in which that he is able to participate in his own care plan and have educated decisions moving forward about dietary choices.
Hi, Mr. Smith. My name is Chloe, and I'm just going to be talking to you about some non-pharmaceutical methods to help control your atherosclerosis. Is now an okay time?
Yes, of course.
Okay. So there are a few different supplements I'm just going to talk to you about today. So the first one is garlic, and that can help with your heart health by lowering your blood pressure and reducing lipid levels. It has also been said that garlic can help reduce the plaque buildup in your arteries. You can get garlic from any food you eat, or you can purchase different supplements. If you experience any adverse effects such as dermatitis, vomiting, and diarrhea, you should immediately call your healthcare provider, and you should not take it if you have any scheduled surgeries because it can cause you to bleed more. So another supplement we want to talk to you about is niacin, and it has been proven to be effective in lowering triglyceride levels, as well as serum cholesterol and LDL levels. With niacin, you would want to start by taking low doses initially and then gradually increasing them. And you also need to take these supplements with meals. Do you have any questions so far?
Are there any side effects with niacin that I should be concerned about?
Yes, so niacin has an inflammatory response, so it can give you a full body rash if you take too much at once. This is why the doses should start gradually and then increase. You can also take small doses of aspirin about 30 minutes before you take the niacin to help minimize the effect. Does that make sense?
Yes.
Is there anything you want me to go over again?
I think I understand the supplements.
Can you repeat back to me some of the things we discussed just so I know you understand?
Yes, I can't take garlic if I have any scheduled procedures coming up because of risks of bleeding. I don't want to ramp up my dosages of niacin too quickly because of potential rashes that I could have on my body. And I can take an aspirin 30 minutes before my niacin to prevent that rash. And if I have any GI issues, I should definitely call my care provider.
Great. So you want to make sure that you check with your primary care provider before you start taking anything. And if you need a reminder, you can always look in your brochure on the front page. And that'll tell you pretty much what we just talked about, okay?
Great. Thank you very much.
Well, have a good day.
Now that Mr. Smith has talked to Abby about his medications and Chloe about non-pharmaceutical approaches to managing his atherosclerosis, he's going to talk to Maddie, and she's going to kind of give him an outlook on the next few months and what signs and symptoms he should be looking out for with these medications or supplements if he decides to take them.
Hi, Mr. Smith.
Hello.
I know you're just talking to some other nurses about medications you could take for your new diagnosis. Do you have any other questions that I can answer for you?
Is there anything that I should be looking out for in the next few months with these medications?
Yeah, so some short-term effects of atherosclerosis include chest pain, pain in the arm or leg, or anywhere else that would have a blocked artery, shortness of breath, fatigue, confusion, and loss of motor or sensory functions on one side of the body,
which both occur if the blockage affects circulation to the brain, and muscle weakness in the legs from lack of circulation. Do you have any questions about any of those?
When would these typically show up?
Many of these effects won't show up until a blockage occurs.
So these are all effects of atherosclerosis?
These are only the short-term effects. There are long-term effects too that another nurse will come talk to you about. Do you have any other questions besides that?
I do not, thank you.
Great, I'll send Amy in shortly.
Great.
After talking to Maddie about the months ahead and understanding his short term, Mr. Smith has concerns about the long-term health risks that he may be affected by his atherosclerosis. He will now speak to Andy, who's going to give him a little bit more insight about the years ahead and the expectations that he should have going forward.
Hello, Mr. Smith. I know you've been receiving a lot of information for your diagnosis and treatment. I just want to make sure that all of your concerns and questions are answered if possible.
Yeah, I have been receiving a lot of information, and it has been quite a lot. But really, I'm kind of worried about the long term, like 5 years from now with my grandkids or their school graduation.
Yeah, that's a valid concern. I want you to know that everyone's case is completely different. The long-term effects can rely on a lot of things, with one of those things being the consistency of your treatment and your lifestyle changes. If you were to not follow the regimen your doctor and the nurses have prescribed, you could have a stroke, a myocardial infarction, a pulmonary embolism, or really any cardiac episode that you do not want to experience.
That's a lot.
I don't mean to alarm you, but your condition should not be taken very lightly, and your choices will determine a lot of the outcome of your health.
Are there any other systems or stuff that I should be kind of looking out for?
Yeah, so if your vessels are still overcome with these plaques from your atherosclerosis, the level of good oxygenated blood being delivered to the rest of your body will lower. As a result, your other organs will not function as they used to before your diagnosis. If you were to not follow that regimented course, you could have liver disease or colon disease.
Okay. I really appreciate the information, and I'll definitely try to maintain my course of treatment out of the hospital.
And then also in your brochure, there is a little section for the associated disorders if you were to not follow that regimented course or anything like that.
Great. Thank you very much.
You're welcome.
After meeting with all these nurses, Mr. Smith has obtained quite a lot of information about his condition. But this does allow him to be educated for the long term and also allows him to be his best advocate moving forward in his future. Taking a step back and understanding atherosclerosis on an individual basis, like the case with Mr. Smith, is great on its own, but the real battle is won by preventing it in our communities. Knowing that 36% of the American population is obese really puts into perspective on how large a percentage of our communities are at risk. It all starts with the individual, and understanding your own dietary and physical activity levels, and the self-care that you allow yourself. Here we've developed a digital poster to spread awareness and understanding about atherosclerosis. We've broken this up under 4 main banners: health literacy, atherosclerosis within the United States, pathophysiology of atherosclerosis, and finally a looking forward section, which is based on developing research which we hope leads to better health conditions for those affected by atherosclerosis. Under these banners, we cover topics such as health literacy, which is an individual's ability to intake health-related information and make good quality personal choices for themselves and their loved ones. The prevalence of atherosclerosis and the large at-risk population of obese people within the United States. The pathophysiology, which involves the accumulation of the lipids on the arterial wall, this causing inflammation and damage and scarring. And finally, our research, which is looking forward to hopeful progress for the affected individuals who already have atherosclerosis and hopeful relief for their symptoms and progression. All this would not have been possible today if not backed by our 2 papers that we have used. One being a health literacy within a diverse community-based cohort, the multi-ethnic study of atherosclerosis by Madison D. Anderson and his team, of which we're able to narrow down specific at-risk communities that have high rates of atherosclerosis. And the second paper here being the pathophysiology and treatment of atherosclerosis by S.C. Bergenhue, their team who is able to understand how atherosclerotic plaques are formed and the cardiovascular complications they create, both of which were cornerstone evidence that allowed us to compile all of this for you today, with the help of the American Heart Association to help fill in some gaps to make this a well-rounded presentation. On behalf of Clinical Group 205, we would like to thank you, and thank you for your time. We hope you learned something new today. Take care.